Welcome, everyone. We'll just give it another 30 seconds here, let people join in, and then we'll get things started. Okay, welcome, everyone. My name is Mike Barrett. I'm the President and CEO for South Bruce Grey Health Center, which is the 4-site hospital along the southern boundary of Grey and Bruce counties. You'll hear more about that when we do the presentation on the hospital overview. But really pleased that all of you could join tonight. Nice to see some familiar faces around the table. I see my old colleague Rose Peacock. Nice to see you, Rose. This session tonight is intended to give all participants a high-level overview of different parts of the healthcare system here in Grey-Bruce. And we have so much going on in Grey-Bruce in terms of healthcare that we've actually divided this into a number of, we're going to make a series out of it, I guess is the best way to put it. Tonight, you're going to hear from representatives from home and community care, from long-term care, and from hospitals. And I'll talk a bit more about that as we go through the opening slides here. Just before we start, some logistics. Hopefully, most people have used Zoom by now. Zoom seems to be the standard method of communication these days. If you haven't, if you take your mouse and hover along the bottom of the screen, you'll see two important buttons here that we're going to use tonight. One is the mute button, so we'd ask everyone to go on mute if you're not speaking. And then in the middle is the chat button. So when we get time at the end or towards the middle of our presentation tonight, that chat button is where we'll be looking for you to put in any questions, and that's where we'll have an opportunity to answer those questions that are coming forward. Can you just go back to that slide for 1 second, please, Taylor? If you're joining us by phone, *6 to mute or unmute your microphone. So again, appreciate if everyone could go on mute, and that way we can always hear what the speaker is saying. So the agenda for tonight, I'm going to start with the land acknowledgement, then do some welcome and introductions, the purpose of the information series, provide, as I said, there's going to be an overview of the 3 areas of the healthcare system, and a really important piece. We're going to give you information, but we also want to hear from you, and that's the last half of the session. We'll keep things moving along briskly because we only have an hour, but you're going to get some questions from my counterpart, Alex Hector, to ask you questions about when you'd like the next session, whether we do it this summer or into the fall. So I just want to start with the land acknowledgement and really starting our meeting in a good way by acknowledging the Indigenous peoples whose traditional territory we have gathered on today. As probably all of you know, the 2 First Nations in the Grey-Bruce area are the Chippewas, the Nawash Unceded First Nation, and the Saugeen First Nation. So some introductions. You're going to see the majority of these folks tonight. I'm Mike Barrett. Alex Hector is my counterpart. And just for context, Alex and I are the 2 co-chairs of the OHT, the Grey-Bruce OHT Planning Committee. Alex is the executive director for the Southeast Grey Community Health Center in Markdale and other sites in the Markdale area. And then you're going to hear from Steph Dudgeon as well, who's chairing our engagement subcommittee. She's done a great deal of work over the last 6 months getting engagement completed for the OHT. And you'll hear from other members of the list there, but their introductions will come shortly. So I've given you the overview of what we intend to accomplish tonight. This is our 3rd Zoom information session that we've had. The first one was for community members, so all the general public. That was on March 24th. The second was for health service provider board members on May 12th. Both of those sessions, this is why we're having this session tonight. We heard that participants want to know more about the healthcare system in Grey-Bruce. They may know a little bit about their own hospital, their own family physician, or their own long-term care home, but they don't have the complete picture. So hopefully we can do that tonight. And we have some great speakers to educate you on, or not to educate you, to inform you about what this system looks like. Hopefully everyone that's joining tonight has heard about Ontario Health Teams. I I like to say every government tries to put its stamp on what the health system structure will look like. We had Ministry of Health regional offices several years ago, several decades ago now. LINs, local health integration networks, health system integration networks. And now we have Ontario health teams. And the big difference with Ontario health teams is that the geography is smaller, and it's really, the government has given considerable influence and options for change to the local community. So people in Grey-Bruce can set the stage and set the direction for healthcare here in Grey-Bruce. So that's what the OHT is. We are not yet approved. We have an application in, but we're still, the application is pending approval from the Ministry of Health. And finally, just before I pass it over to Steph, I wanted to give you an overview of some of the initiatives that the Grey-Bruce OHT Planning Committee is working on. So we've had a planning committee in place to do our readiness assessment, which was probably 14 months ago, to submit our full application. We have the majority of health system providers across Grey and Bruce signed on to that full application. So we're very appreciative of the support that we've got. And items that the planning committee is working on now, we're in the process of developing a collaborative decision-making arrangement, a CDMA, which is the agreement that organizations will sign to come together to create the OHT. We have the Engagement Sub-Committee, which is the group that's put together this session tonight, which Steph is going to talk to you about. We have a nurse practitioner and physician council. So those physician and nurses are coming together so that their voice can be heard around the Grey-Bruce OHT. We have a chairs council, which we're in the process of just getting started. We've asked for membership from different health service providers, and those members, at our May meeting, we said that we were going to have a meeting of that group before the end of June. We have a lot to do with our community council, which I'll talk about in just a sec. And also with summer, this has been a tremendously busy and challenging time for all health service providers as we responded to COVID. So we wanted to make sure that health system leaders had some chance to take some time to recharge their batteries before we start up again in September. So the Chairs Council work will start, in the next meeting will be in September. And finally, the Community Council, a lot of work was put into identifying community council members, patients, clients, families, and residents. We had put out a call for applications. 200 people put their name forward. We interviewed 25. We've selected 10. Those 10, we're going to be doing a notice, so it'll be publicly released. So thank you to those members, that all people that put their name forward. And this is really another important part of the OHT structure, is that the patient, client, resident voice needs to be front and foremost in our decision-making and conversations. So eventually, one of those patient, client, residents will become a co-chair of the OHT. So that's down as we move forward into the future. So lots of process pieces here, and we really want to get into how do we change the system. Before we do that, I'm going to pass it over to Steph, and you can hear about, I have one more slide, sorry. This is the funding that comes into Grey-Bruce from the provincial government. So you may be surprised that over $1/3 billion comes to Grey-Bruce for healthcare. This is money coming from the Ministry of Health, these different organizations. You can see hospital services takes $193 million, long-term care $70.3 million. This does not include a lot of other funding that these organizations receive, user fees, other ministries from the government of Ontario, physician payments, but this is just the amount of money that's coming in from the healthcare. So we provide this to give you some perspective on how the dollars are spread across the Grey-Bruce community. And with that, I'm going to pass it over to Steph. Thank you.
Okay, thanks, Mike. So it's really quite nice and encouraging to see so many people out tonight. A lot of work has gone into the Grey-Bruce Ontario Health team thus far, but we certainly view this as a real opportunity to redesign the system in Grey-Bruce and redesign it for the better. And we are really focused on wanting to engage all stakeholders, and that of course includes community members and users of the system. So it's I'm really quite happy that we've had such a good turnout for this evening session, and I hope that people find this a valuable first step in just gaining an understanding of the healthcare system in Grey-Bruce. I know that many of you will be familiar with different sectors within the system, but most people haven't touched all points of it. So this is sort of an opportunity to really see how the system works and what the, some of the challenges are, and also some of the opportunities that we have to make improvements. So to get started for the evening, we have Cindy Payne, who's the Director of Home and Community Support Services, and Jenna Prowse, who's the Program Lead for COVID Response Home and Community Support Services. So they're going to do a brief presentation tonight, and then there will be an opportunity for questions at the end of the session.
Okay, thank you. So hi everyone, my name is Jenna Prowse and I am a program lead with Home and Community Care Support Services Southwest, and today's presentation is that we are providing here is highlighting the home and community care sector. Next slide, please. Home and Community Care Support Services has care coordinators that work with patients and service provider organizations that provide care to patients. So that's your nursing, your personal support, your therapy for providers that are providing the direct care to patients in the community. The care coordinators and service providers work directly with patients, their families, and other healthcare providers to identify each person's individual needs, develop care plans, and ensure that people get the right care in the right place to meet their needs. Care coordinators and service providers are committed to helping people remain living at home safely and comfortably for as long as possible, avoid hospital and ED admission wherever possible, access community supports, and either after a hospital stay or an event in their life, or even just when patients are calling in to inquire about community services, and provide information about and support placement into long-term care. Types of services offered. So we've kind of drilled this down into 3 areas for this slide. Care coordinators are responsible for distributing resources of home care services equitably across different populations. The care team works to support patients with access to services and system navigation while managing resources in a rationed healthcare system. So the first bucket is our funded services, and these are your professional services, care coordination, system navigation, your in-home and clinic care, so that's your nursing care, your personal support services, your therapy services, and medical equipment and supplies. And then we offer palliative and end-of-life care, as well as remote patient monitoring, which is your telehome care program and your COVID pathway programs. In addition, our care coordinators and service providers work together in supporting navigating the system and linking patients to community services such as meals, caregiver relief, transportation, day programs, and referring into community organizations that offer those services. And then our care coordinators and service providers will also work in supporting coordinating access for patients. So those are placements into long-term care, admissions into residential hospice, supportive housing, adult day programs, assisted living, etc. Type of services offered. So this slide here really shows the service providers that offer services within the Grey-Bruce region. So the professional services are listed along the left-hand side there. So for nursing, our service providers in the Grey-Bruce region is Care Partners and VON. Personal support services is Care Partners and ParaMed. Closing the Gap delivers all therapy services in the Grey and Bruce regions. Pharmacy services is contracted through Brown's Pharmacy, and medical equipment and supplies is through Medigas. Patients and families can access home and community care services in multiple ways. So patients, families, and caregivers can refer themselves. This may be by a phone call or by a walk-in when our offices are open. But many of our referrals do come from primary care physicians or by hospitals following an admission or an ED visit. These colorful buckets along the bottom of the slide just provide some inputs on volumes that we support in the Grey-Bruce region. So 6,800 is the average number of patients receiving home and community care support services per year in Grey and Bruce counties, and that's over a 5-year span, an average number. Approximately 318,000 is the number of visits completed by contracted service providers per year in Grey and Bruce County. So that's your nursing, your PSW, your therapy visits. 19% of nursing visits is provided in Grey and Bruce in community nursing clinics. So not in the patient's home. Patients are going into a community nursing clinic to receive their care. And that number is consistent across the Southwest, and we're always striving to increase that number as the community nursing clinics offer best practice for nursing care in the community. And 475 is the average referrals we receive for our patients residing in Grey and Bruce counties, and that number's over the past fiscal year. Current opportunities and challenges. So opportunities that we're seeing with Ontario Health Teams is patients being supported by a multidisciplinary care team, which would consist of care coordination, nursing therapy, and personal support, linking into the other sectors across the system. Primary care integration and partnerships, so greater partnerships and communication regarding patients and their care between care coordinators, service providers, and primary care, really linking in the most responsible physician with our patient care plans. And coordinated discharge planning, so greater partnerships with our hospital sectors and communication between care coordinators, service providers, and hospital staff to support safe transitions in and out of hospital. Some of the challenges that we're currently facing today as a home and community care sector, our patients have voiced a complex patient journey, finding it difficult to navigate home care services, and this is often due to patients having multiple different agencies and multiple points of contacts and providers entering in and out of their home or connected to their plans. It's very difficult to identify who may be the main point of contact related to their concern or interest in accessing care. Another is health human resources. So the home care sector, as well as many sectors, is experiencing a significant shortage of health human resource, including PSWs, nursing, and therapy health providers. And it brings us right into that next point there, wage parity. So home care service providers are often paid at a lower rate compared to the other sectors. So that's the end of my presentation, and thank you. And we'll look forward to the questions that we have during the question and answer period.
Okay, thank you so much, Jenna. That was a lot of information in a very short period of time, but I think it certainly gives people a sense of the range and scope of services, and also the complexities within even just the home and community support system. There's a lot of services that are being offered to a lot of people. So it sort of gives me anyways just an appreciation for the breadth of what's being offered by home and community care. Before we move on to the next speaker, I should have mentioned before that, as Mike said earlier, this is intended to be a series. So there are many different sectors of the healthcare system, and we didn't want to bombard you with too much information. So we are taking a phased approach to this and are looking at having three sectors present each session, and that's just so that there is time for Q&A after, and hopefully participants are able to leave the session feeling not overwhelmed, but that they're walking away with a bit of information and a bit better understanding. So next we have the Grey and Bruce County Long-Term Care Homes. So I'd like to introduce Jennifer Cornell, who's the Director of Grey County Long-Term Care, and Megan Garland, who's the Director of Bruce County Long-Term Care.
Good evening, everyone. My name is Megan Garland, and I, as Steph has said, the Director of Long-Term Care for Bruce County. It's my pleasure to do the presentation, start our presentation today, and then I'm going to hand it over to Jennifer to conclude it. So Grey and Bruce County, if you don't mind, next slide. As you can see here in our slide, we cover a significant area within Grey and Bruce County, and that's the list of all the long-term care homes that provide services in our area. Next slide, please. So counties of Grey and Bruce are home to 19 long-term care homes, and out of these 19 long-term care homes, we do offer retirement in 5 of them. Home can range from a size of 27 beds to 150 beds. Each long-term care home provides 24-hour, 7 days a week nursing care to approximately 1,325 residents in Grey and Bruce County. 24-hour, 7 nursing care includes access to a physician, nurse practitioner, registered dietitian, social worker, physiotherapy, and occupational therapist. We also provide programs and support, which include restorative care, recreational programming, spiritual care, foot care, and hair care services for the residents. Types of services that we offer. So in a long-term care home, it's a place where any adult over the age of 18 can live and receive help with all of their activities of daily living as regulated under the Long-Term Care Homes Act. We are funded through the Ministry of Health and Long-Term Care in 4 funding categories. So nursing and personal care, program and support services, raw food, and other accommodations. And other accommodations would include environmental services like laundry, housekeeping, and dietary services. In the 19 long-term care homes, we approximately have about 1,800 staff members.
Great, thanks, Megan. So I will take it from here. The long-term care system is hugely complex to narrow down into four or five slides. And I wanted to just add some clarification that of the 19 long-term care homes, there's a mix of for-profit, not-for-profit, and municipally operated long-term care homes. And Megan and I, in our roles as Director of Long-Term Care, support the municipally operated long-term care homes. Jenna, in her presentation, spoke to how to access long-term care and home and community care support services, which some of you will remember as CCAC, or Community Care Access Center, is the support system and the gatekeepers of supporting individuals to the right care at the right time at the right place. And if in fact that is long-term care, they help support admission and moving into long-term care. On this slide are several other links to information about long-term care in Ontario. And I would add, and maybe we can circulate it if there's a follow-up email, there's some other really useful resources. Family Councils of Ontario, Residents Council of Ontario are other organizations that support information and just really excellent resources for people making a decision or having moved into long-term care. Next slide, please, thanks. So there was an opportunity to highlight the challenges faced by the long-term care sector. And there's been a lot of media coverage locally and provincially about long-term care and the challenges faced prior to the pandemic, and then further heightened by the COVID-19 pandemic. Challenges in health human resources, aging infrastructure, and increasing complexity of care of the people living in long-term care. And so we didn't think we needed to write those down, and instead focused on what are the opportunities as we move forward. The recently released final report of the Long-Term Care Commission included 85 recommendations that help forge a path into how we can design long-term care into tomorrow. So we just wanted to highlight a few of those areas. This real shift in focusing on person-centered care, really focusing on each individual's wellness and the quality of their life, and including essential caregivers, family members, and that community of care as part of the decision makers in what that actually means to each individual. And having long-term care homes have a real person-centered, mission-driven model of care. Another opportunity is accelerating the Ontario Long-Term Care Staffing Plan, which is a document that was released by the Ministry of Long-Term Care in early 2021, with some excellent goals and strategies in supporting the health human resources crisis. An increased investment of provincial funding to support COVID-19 measures that will support the complex care needs of an aging population. And some of what the media coverage and commitment from the Ministry of Long-Term Care is in that goal to reach 4 hours of direct resident care for each resident each day. And finally, the leadership support and development through mentorship. Education and succession planning also needs to be a focus and is a great opportunity to support such a transformative shift in how we hold the standard in long-term care. And I would also just like to highlight that while the pandemic has been very, very challenging and very tragic in many circumstances in long-term care, there has also been some silver linings in partners coming together in a very resident-focused, patient-focused, person-focused, solution-focused partnerships to make sure that we're providing the services that people need and that we're keeping our individuals safe, our team members safe, and our communities safe. And so there's a huge opportunity to leverage those partnerships that have been strengthened during the pandemic. And as Jenna mentioned, and Megan, we're happy to answer any questions if there are any at the end of the session.
Okay, thanks so much, Jen and Megan. I agree. It has been a very challenging time across the healthcare system, but particularly long-term care, but there has been many opportunities arise as a result that have been identified. So I do believe that as a sector, it will come out stronger through all of this. So the next presenter is Mike Barrett. So Mike, who started this session tonight, he is the president and CEO of South Bruce Grey Health Services, and he will be giving an overview of the hospital system in Grey-Bruce.
Thanks very much, Steph. And I want to build on what both you and Jen said, is that COVID has brought all organizations across the system much closer together. And even though we worked closely together before, these folks that you're hearing tonight work tremendously hard to make sure that you as patients and people being served within the system, clients and residents, were well cared for, and there was good transitions between the partners. And in a lot of ways, us presenting by sectors isn't the right thing to do for OHTs, but we're doing it so you understand, you have a better understanding of what each part of the system looks like. But OHTs are about all the partners coming together, and I can tell you, Steph and Megan and Jen have done a fantastic job over the last 16 months. So I'm going to take off my South Bruce Grey Health Center hat and put on just hospital hat. And I'm here speaking on behalf of the 3 hospital corporations in Grey-Bruce. And so hopefully, if I don't do well by Grey-Bruce Health Services or Hanover, someone on the phone will let me know. In terms of the budget and the amount of money that's hospitals receive here in Grey-Bruce, it's $193 million. Again, as I said off the top, this is just the money we receive from the Ministry of Health for hospital operations. All 3 hospital budgets are larger than this because we do receive money for preferred accommodations, we receive money for physician payments, we receive money for parking, but this is just the money that we receive from the Government of Ontario for healthcare operations. So just like Megan and Jen did with their long-term care homes, I'm showing a map here of the Grey-Bruce area. There's 3 hospital corporations, as I've referenced already: Grey-Bruce Health Services, which is a 6-site hospital in the northern part of the counties, which has the sites Lions Head, Markdale, Meaford, Owen Sound, Southampton, and Wyerton. And then South Bruce Grey Health Centre, which is along the southern boundary of the 2 counties. That includes the communities of Chesley, Durham, Kincardine, and Walkerton. And then Hanover and District Hospital has a hospital site in Hanover. So there's a long history of hospitals across the province, across the country, and as well as here in Grey-Bruce. The first hospital was established in Owen Sound back in 1889, Walkerton 1902, Kincardine 1908, Hanover 1923, and then the other sites joining in after that. In 1998, there was a substantial change within the health system structure, or hospital structure, I should say, where 6 hospitals joined together to form Grey-Bruce Health Services. So those are the 6 I mentioned previously. It also at that time included the clinic in Tobermory. The clinic in Tobermory has now become part of the Peninsula Family Health Team, and where the hyperbaric chamber is in that clinic. The same year, in 1998, the 4 hospitals in Chesley, Durham, Kincardine, and Walkerton amalgamated to form South Bruce Grey Health Centre. So there was a lot of work done at that back in 1998, and some of the people involved in that I know are on the call today. One of our board members, John Haggerty, was involved in those conversations back in the day. So here's a high-level overview of the 3 corporations. So Grey-Bruce Health Services, 1,900 staff, 700 babies born, about 95,000 emergency department visits. South Bruce Grey, it's 400 staff, 423 babies born, just over 42,000 ED visits. And then Hanover has 180 staff, 156 babies born, and 17,000 emergency department visits. Something that you may not know is that any medical professional practicing medicine within the walls of the hospital either needs to be a hospital employee or a credentialed staff member. So the large majority of our physicians are credentialed staff members. So the process that they have to go through, they submit an application for those hospital privileges to practice medicine within each hospital corporation. And those applications are ultimately approved by the boards of directors after review by the chief of staff and the CEO of the respective hospital. And at Grey-Bruce Health Services, they have 520 credentialed staff members. At South Bruce Grey, it's 240 credentialed staff members. And then at Hanover, it's 100 credentialed staff members. Now, what's probably most important to all of you on the call tonight are the services that the hospitals offer. So I'm going to show you 2 slides. This slide is really the core services that are offered at the majority of the 11 sites. All 11 sites have 24/7 emergency departments. Right now, one of those hospitals, Chesley, is on reduced hours because of a shortage of nursing staff. But when it gets back to its 24/7 complement or operations, then all 11 hospitals will have 24/7 emergency departments. 3 centers provide family birthing, so that's Hanover, Owen Sound, and Walkerton. General surgery is offered in Hanover, Kincardine, Meaford, Owen Sound, and Walkerton. Diagnostic imaging is at all of the sites, and it varies with the difference in the level of each of those hospitals, what diagnostic imaging is offered. So for example, you have a CT in Hanover and Walkerton and Owen Sound, MRI in Owen Sound, but mammography at many sites, X-ray at many sites, ultrasound at many sites. So it varies depending on the size of the particular site. We also have lab collections at all 11 sites. We have assessment centers that have been set up in response to COVID. And then again, all 11 sites have inpatient units, some much larger than others, ranging from a small size up to the large inpatient units you'd see at the Owen Sound site of Grey-Bruce Health Services. If we just go to the next slide, these are the specialty services, and it'll be hard to see the information here. The slide deck is going to be posted on our website, so you can look at it after. But the large majority of those inpatient specialty services are offered in Owen Sound: cancer, stroke, sleep lab, occupational therapy, fracture clinic, congestive heart failure clinic. There's also many specialty services that are operated as ambulatory operations at the other sites outside of Owen Sound, which are listed on the right-hand side. So if you think of the Owen Sound as our secondary center in Grey-Bruce, where many of our referrals from the small hospitals go to for those specialty services. And this is really just to emphasize the important part of this presentation tonight. We're talking about sectors: hospital, long-term care, and home care. But all these sectors need to work together, and we do work together. And we want to make it even better so that when patients, clients, and residents move through the system from their family physician office to their hospital, from hospital to long-term care, that those transitions and handoffs are much more smooth. And I say this often, there's high satisfaction rates for people when they are living in their long-term care home, with their family physician, or with their hospital visit. Where people get frustrated is the handoffs, and when people move between the different parts of the system, and that's where we need to do a better job as system organizations to do that. And again, many of our challenges are the same challenges that you would have seen in the other sectors. Health human resources is probably our largest challenge right now. As I said, the Chesley Emergency Department is on reduced operating hours because we don't have enough experienced nurses to keep it open 24/7. But we've obviously all been busy responding to COVID. We have a high number of alternate level of care patients, those patients that no longer require hospital care, still needing to move to their next destination. A need for more mental health and addiction services, particularly with children and youth. So this is an ongoing challenge for all of us in the hospital sector. Again, working with community mental health and addictions, which is other organizations, CMHA, Grey-Bruce here in Grey-Bruce. So with that, I'll pass it back to Steph, and again, happy to answer any questions.
Okay, thank you so much, Mike. I think tonight's session for me just really, as I said earlier, highlights the complexities of our healthcare system in Grey-Bruce, and really does also spotlight, though, how many opportunities there are to improve the experience for patients as you're moving through the system. Just from learning about these three sectors, to see the range of services available, I think it's really quite impressive that we offer all of this locally. However, I can also appreciate at the same time how there's, you know, opportunities to do things a bit differently, and just to make it a more integrated system. So it being able to be here tonight and start talking about this and learning about it really is a real opportunity for all of us to gain a bit better understanding, and hopefully, you know, be able to contribute to the development of the Grey-Bruce OHT. So I'm pleased with how the session went. When we first talked about offering this session, we thought that we would do 9 sectors in one evening, and it quickly became apparent that there's just way too much information to cover to be able to do that. So Alex will be taking over the latter part of this session, and we'll be looking for feedback, but certainly if you have feedback to share tonight in the chat box or through the OHT website, or just a personal reach out as a engagement subcommittee, we certainly want to hear about how you want to learn, how you want to be able to contribute and participate. And we're learning, all of us, as we go. So certainly please feel free to share any feedback that you do have. And now I'll move it on to Alex Hector, who he is the Grey-Bruce Planning Committee co-chair alongside Mike, and he's also the executive director of the Southeast Grey Community Health Center.
Thanks, Steph. Can you hear me? I've been having technical problems today. So.
We're getting a little bit of feedback, Alex.
Can you hear me all right?
Oh, that's better. I think that's better.
That's better? Okay, super. Great. Well, thank you very much, Steph, and thank you to the presenters for staying on track. We're right on schedule. So this is the so what we've got left in terms of the meeting is the Q&A process. So please, if you have questions, type them in your chat box. Jen Kehoe is going to be the traffic manager on this, and I'll be the facilitator to find the person to answer the questions that you have. We've also got 2 polls to complete, and we'll take a few moments once we've had a chance to get into the Q&A to complete those polls. Those polls are intended to help us with a little bit of formal feedback that the entire group can see, and we'll take that feedback away and use it to enhance subsequent sessions. So without further ado, we'll see if we get some questions. I hope there's a few.
Okay, Alex, so we've got one question in around long-term care homes. The question is there extra training for care staff regarding various forms of dementia that residents might suffer from? And how many inspections have there been at our local long-term care homes in the past?
Okay, great. Good question. Thank you. Megan and Jennifer, I'll turn that over to you.
Great, thanks. And thanks, Richard, for the question. In terms of specific training for dementia and responsive behaviors or personal expressions is the language that is being used now with some of the challenges that come with living with dementia. There's a lot of opportunities and specialized support and training for our team members in our long-term care homes in the Southwest Lynn, which is, we are part of that broader geography. There's a system that's been in place for a number of years that is a Behavioral Supports Ontario, and it's embedded, it's funding specifically to have embedded champions that are trained in supporting residents with dementia and with responsive behaviors. And part of their role is to work with our partners across the sector, so other experts from the hospital, from the Alzheimer's Society, those types of partners, to make sure that we have the latest training, the latest tools and strategies to best support residents at the home that they live in. There's training called gentle persuasive approach. Those are the types of additional tools and training that are available. Locally, in one of the homes that I support, we have just been approved for a pilot for a behavioral support transition unit in Markdale. And so we're working on getting that up and implemented. And so there'll be more information coming about that. And that's a fully funded, specialized home area in a long-term care home to support residents with responsive behaviors to help them transition into traditional long-term care or into back into the community, back to home or their home of choice. I hope that answers a little bit. We could probably spend the next 40 minutes talking about that, but just to give you a bit of an overview. And in terms of inspections, I don't know the answer off the top of my head regarding the number of inspections. I can speak to the 3 long-term care homes that I support, and we did a presentation this morning to our committee of management, and each of our long-term care homes have had a recent inspection. So the 3 that I support have had inspections. We can circulate, if we're circulating information following, we can include the link for where those reports are publicly reported. And then you could look up any of the long-term care homes in Grey-Bruce to get a sense of when their inspections have been and what the results were.
Okay, great. Thanks very much, Jennifer. Really appreciate it. And we'll move along quickly here. The HR shortage, and that's been sort of a common theme from a number of the presentations. The question is, and I'll ask Mike Barrett to address this one. Sorry, Mike. Is the OHT looking at ways to coordinate recruiting, training, et cetera, so that all sectors can benefit?
Alex, I might pass it to Jen because Jen has done some wonderful work on PSW recruitment with the Integrated Health Coalition. And then I can speak more about some training for surgical nurses, but I think Jen's done some great work already.
Sure, thanks, Mike. So yeah, there has, as Mike mentioned and I mentioned, the partnerships that have evolved through the pandemic. One example is a partnership between the Y Essential Skills Program, Georgian College, the Grey and Bruce long-term care homes, and I'm missing some. The provincial government has fully funded specialized training to support individuals who may have an interest in working in long-term care, and it's an essential skills program. It's a web-based with some in-person, and it prepares people to kind of do an introduction into healthcare, and then helps guide them on a path, hopefully, to a career in the health system. And I think that this is a really exciting and innovative partnership that helps to plan. It doesn't necessarily fix anything tomorrow, but it helps lay a foundation for the future. The Integrated Health Coalition, which is a group of partners from across the sector, have had small working groups focused on this health resources challenge. And another innovative thing that we did was talk about PSW. What is a PSW? When we went to schools, high schools and a couple of public schools, and we talked about the different roles that a PSW can have in different parts of the sector, hoping to inspire a spark to get some people interested in working in the healthcare field.
Great, thanks, Jen. And Mike, you're going to comment from a surgical nurse perspective.
Yeah, just a quick comment with the government's approach to recover from the COVID pandemic. They're providing some funding to support getting those surgeries that have been delayed or deferred back up, and so people can get those surgeries that they've been waiting for. And one of the approaches that the hospitals across the Southwest region are looking at is actually having a training ability for surgical nurses and critical care nurses. So we're working together with our hospital partners to get those nurses trained, because in a rural community, you just can't send out 5 nurses to go to a training session in Hamilton or London, because you need those 5 nurses to be able to work the shifts in each of our sites. So we're trying to get some homegrown training here, and we're going to access some of those dollars from the government to do that.
Excellent. Thanks, Mike. The next question is back to long-term care. What is the interface, if any, between the not-for-profit and for-profit facilities in the long-term care system in Grey-Bruce? So Jen or Megan?
Yeah, I'll take this one again, just because I'm the co-chair of the long-term care committee and partners. And so there's been, for decades, the 19 long-term care home leaders have been meeting and networking, problem solving and working together. And that has just become even more of a formalized and structured process during the pandemic. And we've expanded to include our system partners. So we were meeting once a week, and now we're meeting via Zoom, and now we're meeting once every 2 weeks. And we're going over the newest directives. We're working together, trying to make sure we have some consistency in how each long-term care home approaches the directives and the rules, particularly with COVID. And yeah, so, and that includes profit and nonprofit, municipal, and it's been working really well, and all in the goal of supporting the residents experiencing long-term care right now.
Great, thanks, Jen. Next question, I'll move this along because we're getting quite a few questions and we're going to run out of time. We were talking about improving the handoff of transitions between sectors and among services. Has there been any ideas on how this might be approached, or will that surface within the councils? So Mike Barrett, is that something you can help us with?
Sure, and again, there's lots of partners around the table that could answer this question as well. In terms of the OHT, we're spending a lot of time on process pieces and getting the structure ready, but these handoffs and the care pathway for patients, clients, and residents, those conversations have been going on for years. So we need to actually capitalize on some of the change that we could make to make those handoffs better. So we've got a lot of work to do, and whether it's in COPD or other parts of where people are receiving service within the system, we will be advancing initiatives. We don't have any concrete ones right now at the OHT table, but we'll be moving those forward to make sure we've got stronger initiatives. I think the key part is that partners are coming together and having these conversations. So what you see tonight is going to be advanced into translating into better handoffs for patients and clients and residents.
Excellent. Thanks, Mike. Home and community care support services. How many nurses are available for home care, and what would the optimum number be? So Jenna, is that something you can help us with?
I'll maybe jump in here, and thanks for the opportunity for allowing us to present tonight. I do not have an exact number of nurses. Your care providers in Grey-Bruce are care partners in VON. I can say that in the height of COVID there, we certainly did have a nursing shortage where really systematically there were so many opportunities for nurses that were needed in other areas. Public health, for example, scooped up a bunch of nurses that were really essential for that wave of COVID for that work to happen. In today's landscape in home and community care, we are really shifting to a community-based model for anybody who is mobile, and that is in direct correlation to try to ensure that we have capacity for those that need care at home the most, have a designated nurse that is able to get to home. So as of today, there is no wait list in Grey-Bruce for nursing care, and there is lots of capacity in our community nursing clinics.
Great, thanks very much, Cindy. Appreciate that. Question back to long-term care. How many new PSWs will be on tap in 2020/2022? Sorry, 2021/2022.
Sure. Thanks, Alex. It's Megan here. I can take that question. So it's a great question because we know that the health human resources has been a struggle for all healthcare providers. Part of the challenge that happened at COVID is when everything locked down in the beginning of 2020 in March, a lot of the school programs got put on hold. So there was a significant amount of time where we weren't seeing graduates come out, and we rely heavily in long-term care and on our graduates and the continuing increase of the number of people entering the PSW field. The great news that's happened since that hold is the government has instituted new initiatives that have basically provided free schooling for PSW and paid placement. So what we're seeing right now in the sector is many programs happening in the private career colleges, but also in the public colleges. So we believe there's approximately 3 cohorts right now happening through Georgian College, but there are several private career colleges that are also partnering with long-term cares and doing initiatives. So we are anticipating starting in September to start seeing new graduates come out at a much faster speed than we have been used to, and so that we're hopeful. But the exact number is we're not able to report on it, except for the fact that things are looking better in the world of recruitment for PSWs going into the next couple of months.
Great, thanks, Megan. The next question, how many people in Grey-Bruce do not have a primary care provider? And I'll weigh in on this one and then I'll invite any others to supplement my answer. I don't have an exact number, but what we do know based on a survey that was done, I believe it was in the fall, can't remember exactly when, but basically a community-based survey from across Grey and Bruce with well over 1,000 responses. Access to primary care is the #1 issue. And that's either access in terms of timeliness or access in terms of just being able to find a primary care provider. Anybody want to just jump in and supplement that? Okay.
I was just trying to, sorry, it's Cindy. I was just trying to pull up quickly the Healthcare Connect program, which is housed out of the Home and Community Care Support Service as well. I believe there's somewhere around 5,000. I was trying to get the right number, exact number for Grey-Bruce, which I'll find before 7 minutes here. How many are waiting on that waiting list for a primary care physician?
Yeah, and that would also be part of the story too, because I think that there's also a number of people that have moved to the area that still have their primary care providers in their home destination, and obviously a lot of people moving from the GTA, as an example, still drive back to see their physician back in Oakville and that type of thing. So definitely, it's an area of concern right across the board. So next question, as the OHT succeeds in coordinating across the system, could we expect resources to be used more efficiently in addition to ensuring high quality care? And so I'll jump in on this one and then ask Mike to sort of just add perspective on it. Absolutely, yes. That is one of the key purposes of implementing an Ontario Health Team construct, and it gets into the quadruple aim, and it's one of the key sort of planks in terms of this transformation of the entire healthcare system. We know that there are opportunities to become more efficient financially and better in terms of the quality of service that we provide. And so being able to do both is one of the essential foundations or planks in this whole change initiative. Mike, did you want to add anything to that?
The only thing I'll say, Alex, is that people think that high quality care is more expensive care. I'd argue it's the opposite, that high quality care is actually more efficient and you use resources more efficiently. And a good example of that, if we got somebody in the emergency department and we send them home and not connecting them with the proper supports in the community, whether it's mental health and addictions or home care, as you heard from Jenna and Cindy, that person's going to come right back to the emergency department in a very short period of time. But if we can make that transfer complete, get them the supports that they need in the community, they're going to stay in the community, and we're not going to have this back and forth, which is better from a patient experience perspective, but also from a cost perspective. And there's all kinds of examples like that. You know, the interaction of residents in long-term care homes moving between hospital and long-term care, ensuring that that transfer doesn't have to take place and they're cared for in their own home, in their own long-term care home. That's better quality care, and ultimately it's going to be more efficient as well. So there's lots of things we can do that are going to make it higher quality and more efficient.
Absolutely. Thanks, Mike. Just on the previous question in the chat window, Cindy, thank you for that. There are currently 3,749 patients waiting primary care that have registered. Final question, and then we're going to do a poll, and we're right on track in terms of time. There was a mention of increased suicides in the area. So is there more emphasis to acknowledge the problems and have some public awareness of how to help reduce this problem? Anybody want to take this one on?
Mike, I can't speak for the adult system, but for the child and youth system, certainly there's a huge emphasis on trying to get young people who are experiencing suicidal ideation and depression and anxiety out of the hospital systems as quickly as possible and into the community-based services. I know that the Canadian Mental Health Association does the same with all of the programs that they operate throughout in the adult system. I don't know if there's anyone here from CMHA that wants to speak to that, but there is a great emphasis in trying to move young people out of the hospital system as quickly as possible and provide a service in the community to prevent recurrence of any untoward behavior.
Thanks very much, Phil. Really appreciate that. Okay, so we've got 2 polls to do, and then just a quick wrap up. So the first poll is the value of this session to you as community members. So if you could just take a moment and put in your tally there, so we can see how we're doing. And we'll use this information to help guide us in subsequent sessions. Great. 34 of 48. 38 of 48. 85% voted. Just a couple more seconds. 42, 87% voted. So what we've got, Jen, can everybody see this poll on their screens? There we are. So either agree or strongly agree, 91%. So thank you for that feedback. That's very helpful. And if you have ideas and suggestions for subsequent sessions as well, please don't hesitate to send us an email. Get hold of any of us, myself, Mike, Jen Kehoe, or any of the committee members, and provide that feedback into us as well as to staff. And we'll certainly take it under consideration for subsequent sessions. The next question is timing. So we're into a summertime period. People have different plans throughout the summer. In the healthcare system, we're trying to re-energize our workforce by not doing a lot of change and a lot of special projects. When's a good time for us to get together again for our next session? Would it be in August or September? So I see everybody's they're answering now, which is great. We're about 48%. So we're getting there. 78% voted. Almost there. Looks like the voting's leveling off here. Okay, we'll flash this one up on the screen. Jen, if we can do that. Okay, so 66% have said September makes more sense than getting together in August. So thank you for that. That gives us enough time to prepare for the next session. And we're thinking, as Steph mentioned earlier in the session, we're probably thinking there'll be a need for 2, 3, perhaps 4 of these sessions to provide this kind of information. Interestingly, from other OHTs that we've heard from, they've also embarked on similar journeys in terms of providing these information sessions. It is a complex system and it is very large, so it's important for everyone to have a really good sense, not be an expert, but have a good sense from an overview perspective. So that being said, I want to say thank you to both our presenters as well as our organizers, as well as all those who attended this evening. I really appreciate your time and your interest. I think your interest and participation is really essential for our OHT as it evolves, and we really do appreciate your time this evening. So without further ado, I'm going to just say thank you and have a wonderful evening, and we'll be in touch soon around the next session. Have a great night.